always pleased to have Sheila Sheffield McCormick having the short conversation about the community because she's passionate. She knows what she's talking about. She's a very good health advocate. She's a lawyer, but she has hope for the community. Sheila, you were mentioning earlier that you work actually with several pastors in the community, and I was amazed to see how excited you were talking about how you see uh, you see the organization making stride, moving forward to help the community. So, how were you able to reach so many pastors in such a short period of time? Because I know that your board is very diversified, and I think because it is so diversified, it helps you be able to outreach. I would say properly because you have to be culturally sensitive when you're outreaching because you cannot do an outreach campaign only to the Catholic or to the Baptist. You have to bring everybody else together. So tell us about your board, about how the diversity of your board help you. Uh, I would say fight this challenge that we are facing with COVID and what people believe that they should do.
Well, one of the things that I think makes us very unique is that the board members have been living in the community, leading
Okay.
different initiatives in the
Mm-hmm.
community for a very long time.
Mm-hmm.
They grew up in the community.
Good.
So a lot of the people who they know are the hairdresser, the one who you take to cut your
Mm-hmm.
son, the barber. All
Sure.
those people you have personal relationships with, and they actually trust these women. But on
Mm-hmm.
top of that, they're also healthcare professionals. So, if the doctor and who you go to school with and who you bring your son to school with is telling you something, you kind of listen to them because you trust
Yes.
you've eaten dinner at their house. So we have those relationships. So that's what helped us facilitate the Pastors Coalition. We've even had coalitions now with the mosque and with different Brazilian churches because that's where we live and breathe every single day. Like when we're living life, it's with these people. So we can actually talk to them and say, hey, this is what's
Uh-huh.
needed. And it's a
Mm-hmm.
trusted voice.
I love that. I love that you know, as I'm talking to you, I would say that my brain is going other places. And you mentioned the mosque. Yes, we do have black and brown people who are part of the mosque, and we have black and brown people who are actually Jewish and Christian and voodoo priests and all. So I am now very excited to the fact that this initiative. I would say though young, but has done so much. You
Yes,
know.
yes. It's because of the just the service that we've done before. It's
Hmm.
there's nobody here who's new to it, who's like, oh, this is
Okay.
my
Okay.
first time
Hmm.
servicing. So
Hmm.
when you've been doing it, it's just a collaboration. It's just a
Okay.
collaboration. And we came together as a nonprofit because we knew that's the most effective way to get it into the community. Just coming together as a unorganized group
Hmm.
isn't going to do it. It's not going to cut it, especially when it comes to healthcare and accountability. So that's why we felt the need to come in that way. Yeah, we've been together now, I want to say for 2 months, and we've been able to secure a lot of resources. We've
Hmm.
been able to secure just the ability to reach the community. It's for what I
Hmm.
said. Like I said, it's really because of the heart of the people on the board. They've been serving, their kids are there, and so we're able to do it quicker as a community.
I'm always proud to say that you're the director of leadership for the Haitian American Chamber of Commerce, and you bring it back to the reason why you are such a great leader. Because at the end of the day, it is about relationship. It is about the relationship that you build. It is about the accountability that you could bring. Yes, it is true that the organization is barely, I would say, 2 months because it was in December when this whole thing started as you were watching COVID not going away. But I would say that the relationship that you have with the members or your boards are long lasting relationship, probably over 40 years, because I know some of them, for a long time. So I think it's very important. And I think that the people from the Global Business Talk Show will take this away from the fact that relationship building is very important, whether you will leader, whether you see yourself as a leader, whether other people see you as a leader, but in business in general, if you want to conduct business and you want to move forward, relationship building is very important. And I want to tell you, congratulations, not only for being able to do this, because they often say that black people don't work together, but to be able to keep good relationship and long lasting relationship with people. This is something that somebody needs to work at on a daily basis. So now, past COVID, when people will be able to hug, Maybe, maybe not. I see each other. How do you see us moving forward? Because your organization is not only there for COVID, you're gonna go beyond COVID. So, how do you see us? I don't even want to say the word coming out of it because people are telling me it's gonna be a long journey.
When COVID's over, is that what you're asking about? I remember in the
Yes.
beginning, you used to say, when COVID is over, I say, you know, when COVID's over, let's go get, some drinks. And now we're
Yes.
like,
Uh,
as we
uh,
transition,
as we transition.
as we say, so, there's a few things that we have planned. And as you mentioned, relationships are imperative, but along with in relationships comes expertise. And that's what we have
Yeah.
in the organization. We have women who are passionate, who are not only experts, who have displayed their expertise, their professionalism, their consistency. These are people, everybody knows you can rely on. If you
Yes.
call and you said, I don't know this, could you please explain? You'll get an honest answer. If it's, I don't know yet, because I'm going to educate myself on it, or I'm not sure yet, and I'm going to connect you. I think that's the real heart of the matter, why we've been able to push so quickly, is the relationships, the commitment to being excellent. And that's what the organization does. We want to be excellent for our community members, and not just towards our work, but in our community. And as we go forward, we want to continue that excellence in healthcare, as far as making sure that the community is healthy. Our vision is coming out of this 100%. And coming out of this 100% is that we're dealing with comorbidities, that we're testing for COVID, we're educating for the vaccination, and that we get everyone vaccinated at the proper time. And getting everyone vaccinated at the proper time is going to take a trust level that we're starting now, that we've been starting, and we're building those relationships. So when everyone's ready, it's going to be accessible. And that really is the heart of it. Because I have conversations with some people, and they say, you know what, I don't trust the vaccine. And I asked them to come along with us for the fight, because even if you don't trust the vaccine, that doesn't mean that people who want it should be denied access. So this is an accessibility and equality issue. So we fight to make sure that the vaccination is available to everyone. So when you are ready to take it, it will be there for you. So that's our goal, is to make sure that we come out of this 100%, and we come out healthier, stronger, with new traditions of health and healthcare and mental health in our communities.
True.
And so, we could talk about, remember when there was COVID, or remember when people didn't do healthcare, or people didn't do mental health? Those have to be the conversations of the past, back in the day when we didn't have access to healthcare. And so that's what I'm envisioning, a world that we talk about. Remember back then when there was no healthcare for us? That's what we're heading towards.
A word of reminiscence. Sheila, I want to tell you that I'm very proud of you, of your endeavor. And the Haitian American Chamber of Commerce is standing behind you and your team for the work that you're doing in this community, for the love and the passion that you feel towards this community. We love you very much, and we will wish you continued success.
Thank you, and thank you, the Chamber, and all the community members who have been helping us push, all the members of the Haitian Chamber who have been enduring all the messages as we try and get you all the relief and all the things that you need. Your work in the community, Janan, has been remarkable, innovative, always on the forefront, and we truly appreciate you as a great leader in our community, and even your heart to give and mentor. It's undeniable and appreciated.
Thank you, thank you. It's teamwork. Teamworks make the dream work.
Right? Teamwork makes the dream work, right?
Thank you so much, Sheila. Thank you for being with us today on the Global Business Talk Show. We hope to have you soon. Uh, the platform is here for all your board of director, so they could talk about how they feel and what their expertise are.
Okay, that's wonderful. Thank you
Thank
so
you.
much.
You're welcome. Bye bye.
Bye.